We are right at the top of the hour, so I'm going to go ahead and kick us off. My name is Katie Trotter, and I'm the Chief Program Officer for the Chapman Foundation for Caring Communities. And I will be your panel facilitator today. We're very excited to have you join us for another Courageous Leaders Series event. I'll go ahead and first turn it over to Lainey, who will be working with us today.
Thanks, Katie. So my name is Lainey Gager, and I'm the Learning Operations Leader with the Chapman Foundation. I'll be the concierge for this session, so I'll be supporting you all and our facilitators and panel members. So if you have any questions or tech issues that arise, please feel free to put that in the chat, which you can access by clicking the chat icon in the bottom toolbar. If you have questions that you'd like to ask the panel today during the question and answer section, go ahead and put that in the chat at any time, and I'll be sure to keep my eye on that and keep track of those questions for us. During the session, we do ask that you keep your microphone on mute so that we can cut down on background noise. But if you would like to ask a question during the Q&A portion, you can feel free to come off of mute then. We also ask that your name is correctly displayed, which you can change by clicking the three dots over your face if you hover over it. And if you click on that, you can select rename and just make sure you have your first name there and your last initial. And that will help as we take attendance for the session. And the very last thing is that the session is being recorded today so that we can share this with those who registered but aren't able to attend. I believe that is it. So I'll pass it back over to you, Katie.
Thank you, Lainey. For those of you who've not attended one of these panel events before, I do just kind of want to walk us through what the agenda is going to look like over the next hour. In just a couple minutes, I'm going to go ahead and introduce our two panel members that are joining us today. And then we'll give you an overview of what the partnership model is when organizations choose to work with the Chapman Foundation, working towards a caring workplace designation. And then we'll have some conversation with our panel, talking about some different research that exists on what it takes to cultivate a caring culture. And after we get through with our discussion, as Lainey mentioned, we'll have an opportunity to open it up for a Q&A at the end. So please feel free at any point to drop your questions in the chat, and Lainey will be collecting those throughout the hour so that we can ask it right towards the end. And then finally, we'll wrap up with just some potential next steps for you or your organization if you're interested in learning a little bit more about the programming. So we'll go ahead and jump in. Our session today is about transforming healthcare with a culture of care. And both of our panelists are here from the Medical University of South Carolina, which you may hear us shorten as MUSC. And today we have David Howell, Leadership Excellence System Manager. David, thanks so much for joining us today.
Thank you. It's good to be here.
And we also have Maggie Dillehay, MSICU Nurse Manager. Maggie, we're excited to have you here.
Thank you. I'm excited to be here, and thank you for everyone that has joined.
We're looking forward to hearing from you both. And I mentioned right at the beginning that the Chapman Foundation for Caring Communities partners closely with organizations and communities that are really being intentional about the work cultures that they're creating, cultures where people feel cared for and connected to the work that they do. And MUSC is one of our caring workplace partners. Now, when we talk about partnership, we're really looking at this three-part approach to culture change. So when organizations like MUSC or other partners work with us, there are three elements to keep in mind. One is that we focus on empowering every single team member. We provide engaging learning and development opportunities that really focus on strengthening emotional intelligence, improving teamwork, and helping individuals understand how their individual behaviors and contributions actively contribute to the culture that they're a part of. The second approach that we take is working with leadership teams directly. We know that culture change does not happen by accident, and leaders are holding so many different things at one moment that we really help walk alongside them as they are working to embed culture into strategy and systems and processes to make sure that it's really embedded into everything that the organization does. And then, like all good programs, we've got some data work, right? But we want to make sure that we're measuring what matters to our partners. So we really want to focus on measuring how we're impacting individuals, but also doing some pulse surveys where we can see, are we really moving the needle the way that we're hoping to when it comes to creating these caring cultures? Now, this type of work around culture change couldn't come at a better time when you look at stats that exist across the United States in workplaces. You can see that 74% of people listed work as being the leading cause of stress for them as an individual. So much so that their supervisor is actually more important to their health than their primary care doctor. So you can see that final stat there where you see the direct tie with higher levels of stress when it comes to work. There is actually an increase in Monday morning heart attacks. So that feeling that people get on Sunday night when they go to bed, knowing that they're about to head into work the next day. We continue on to look at the stats to see that 3 of 4 people, likely within your organizations, would say that they are feeling disengaged from their work. And 7 of 8 have the sense that their company doesn't actually care for them. And you can see that this level of feeling disengaged and this lack of connection and care has an impact on the way that they're viewing their relationship with their supervisor. So 58% of people said that they would actually trust a stranger more than they trust their boss. And 65% of employees would rather see their boss get fired than have a pay raise. So we see these statistics that are being collected across the United States that are painting this picture of why we need to be doing such intentional work within our cultures of our workplaces. So these are kind of general questions about workplaces, but what I'd really love to do first is to talk with our panels about what are some specific challenges that your team or your organization were facing before you started partnering with our organization. And Maggie, I'll go ahead and kick it to you first.
Okay, thank you, Katie. Well, I think that anytime anyone takes a position in healthcare, we know there's going to be challenges and struggles. But just a little background for me, I took a nurse manager position about 3 years ago. And when I started this position, I was extremely overwhelmed, juggling so much, high acuity, staff turnover, emotional exhaustion, hitting quality metrics, and trying to get staff to just be engaged. There was a lot of pressure to make sure that we were performing at our best on the hardest days. So really, one of my biggest struggles was communication overall. Where I work, everything's moving fast. We're constantly responding, reacting, making decisions. And I was seeing most of the conversations that were being had, me involved, were very task focused. There wasn't really any real connection. For example, sometimes misunderstandings or disagreements would snowball and people would shut down instead of speaking up. I was seeing this happen, especially, excuse me, in like our high stress situations, emergencies, disagreements in care plans, and even end of life care. I could feel the emotional wear and tear. I could see it not just on my team, but on myself. And I feel like the wear and tear of this emotional exhaustion, compassion fatigue was really contributing to the burnout of the staff and just the overall disengagement. So I was really struggling with how to respond to this and to everyone feeling the burden. I wasn't sure how to support them or really show empathy in these conversations or to their burnout. I had my own burnout. And I really wanted to be the leader who truly supported them and lifted them up. But I was really lacking the tools to consistently show up in that way. So in conversations and when this would happen, I felt like I was fumbling around trying to be that person, that support person. But a lot of times there was just silence. I didn't know how to respond. I didn't know what to say. And so this is when I took the Our Community Listens course, one of the foundation courses. And it made such a difference, and it still makes a difference. I use it every day. This course really has showed me how to slow down, really think about how I show up to these conversations, and how to listen, not just what I say, but how I truly listen. Prior to this course, it was all about how do we get to the end of this conversation so I know what to fix. I was all about, I need to fix this. I have a meeting in 15 minutes. I was totally disregarding the whole point of it. Sometimes your care team member just wants you to listen. It's not always about having to fix something. They want to talk through a situation, or they just want to vent. And so I wasn't really good at that. one thing I really learned from the course was my own communication style through the DISC profile, and how to flex that communication style based on the tendencies of others and picking out those tendencies. I think it allowed me to become more self-aware and intentional of how I communicated with them, um, especially like in the high stress moments that I mentioned earlier. So after reflecting on this is how I'm feeling and this is what I'm experiencing, and taking this course, and learning how to really listen with empathy and respond and there not be so much silence, I realized if I'm feeling this way, my charge nurses, my leaders have to be feeling this way. I've been in a leadership position longer than they have, and they're brand new, and this is my role and my job to really mentor them and coach them and help them through the same situations that I was feeling. Um, so now taking our community listens has really become part of our leadership development on our unit. I encourage it, I support it, I actually require it. And it's been really powerful to watch some of them grow and practice and use the listening skills and the conflict resolution skills that they're learning through it also.
Maggie, thank you so much for sharing that. And I really appreciate the intentionality that you as a leader have of saying, hey, I've identified an area where we need to grow, and I may not have the skills right now, but I'm going to learn them so I can support the very people you're taking care of. So thank you. David, I'm curious to hear from your perspective, maybe a little bit at a broader, full MUSC level. What were some of the challenges that prompted you to start this partnership?
Yes, absolutely. And I just want to sort of accentuate sort of what Maggie said. And like you said, from a healthcare system, I'll talk about some challenges that we were experiencing in our decision to sort of partner with the Chapman Foundation. So as everyone knows, COVID happened as a pandemic, and it's impacted our industry still today in 2025. And so when I learned of the Chapman Foundation for Caring Communities, we were on the heels of recovering from COVID. And if you're in healthcare, which everyone on this call I think is, COVID really impacted us as an organization, and it impacted us in terms of the healthcare landscape. So from there, we had to sort of redig on how we treat each other as people, how we treat our patients and families in the midst of rethinking how people work and want to work in our industry in terms of struggling with recruitment and retention. So sort of from a holistic viewpoint, we thought this would be a good alignment for the struggles that we were currently facing post-COVID in terms of what Maggie said, right? So burnout and meeting metrics and meeting performance goals, but at the same time, ensuring that we're putting people first at our organization. And that empathy is really important to us. And knowing that in order for anybody to, or any organization to achieve success, performance, strategy, whatever it is, we got to get the people stuff first. And if you don't have the people stuff first, everything else is hard. Patient outcomes, patient satisfaction, retention, and recruitment. And so it just made sense for us to explore more tools that would lead us to be more human-centered in our organization on the heels of COVID, as we're trying to rethink our industry and the impact that COVID made on our organization. And we're still trying to reel from some of that. Healthcare looks a little different in 2025 than it did in 2019. And so the Chapman Foundation for Caring Communities has allowed us to build alignment in terms of those things that are really important to us in putting people first.
David, thank you for sharing that. And I think as we speak to this idea of Maggie mentioning the foundational courses and David, you mentioning this human-centered approach, I just want to give a brief overview of what the courses look like that David and Maggie are referring to. The first foundational course is our Community Listens. And this is where we focus really intensely with people on your one-to-one interpersonal communication skills. How do we learn to truly listen to each other? And how can we reach a point of accepting one another even when we might not agree on a topic? And also this concept of how can we have really difficult conversations, but do it in a way that's still going to maintain the relationship and actually build and deepen trust within our teams. From there, everyone has an opportunity to take our community serves. And this is where we really start to focus on that team culture environment. We're learning about how do we develop service mindsets and behaviors that are really going to help shift from me-centric approach to we-centric approach. It's also in this section that we talk about adapting accountability mindsets and learning where we have opportunities to take ownership. The third foundational course is our Community Transforms. And as I mentioned closer to the beginning of this call, that's where we get to work with people who are in organizational leadership roles, where we really start to help them see, how do we embed a coaching culture? How do we start to put some of these things from listens and serves into our job performance reviews, into our strategic planning, so that we can really make sure that it's sustainable and being lived out all throughout the organization. All of this is done so that we can be consistently demonstrating to the people in our span of care that they are seen, valued, and heard. So with those courses in mind, as a part of what MUSC is participating in, Maggie, I'd love to ask this first question for you. What are some of the impacts that you've observed since partnering with CFCC and participating in these foundational courses, whether it be through patient outcomes or even just the culture of your unit in general?
I can speak to both of them. So I can speak to the patient outcomes part of it first. So in the MSICU, one of the most difficult things to navigate is the family dynamics, the family challenges. We see it on a day-to-day basis. There's a lot of emotions. Families, they have loved ones in the unit. They're trying to navigate the grief, loss, fear, just uncertainty of what's next. After I took the Our Community Listens course, I felt like I was more equipped to handle the hard conversations, how to respond more empathetically, and how to listen to the families. And I would say also, having conversations with some of these families, allowing the charge nurses or even the bedside nurse to sit in on the conversation, so they can pick up some skills on how to approach similar situations in the future that they might have. I also like to mention the ripple effect that this brings. So when families and patients, when they feel heard, when you listen, when they feel supported, then they're more trusting, more involved. They're more at peace with the care that we're giving them. There's more trust in the care team, even when there's an outcome they don't expect or that they had hoped for. And I think that human connection really matters, just as much as any like task or intervention that we're doing for that patient. I also mentioned the APPs. So the physicians in our unit are also taking the Our Community Listens course. And I think that overall, it has strengthened the patient and family experience in our unit, with having the leaders building on these skills and using them, as well as the physicians. As far as like the unit culture, MSICU is a highly engaged unit. Our employee engagement results reflect that every year. So partnering with the Chapman Foundation has really helped us shift from just functioning as a team to truly connecting as a team. My clinical staff leaders have really helped bridge that gap also. They're self-aware, they're more self-aware. We are learning, still learning. This is an everyday learning, that our tone, our body language, our approach can really shift an entire conversation in the right way, especially when holding others accountable. So we were able to learn these skills in these courses, and nobody wants conflict. If it were up to me, I would just avoid it entirely. But the foundational classes really has helped me have the difficult conversations and to realize it's not something to be afraid of. It's just now I have the skills to approach it in a different manner. It's taught me to be comfortably uncomfortable, but having more confidence than I did before in doing that. I feel like when issues come up in the unit, we're quicker to address them. But with a little bit more understanding, a little bit more grace, there's more openness in the way that we give feedback to our staff. And there's more openness with how we accept feedback from the staff. I think the leaders and I continue to just grow in our roles with more confidence and better communication skills. And I hope that over time, and we're seeing this, that this will help with retention. When people feel heard and supported and connected, they're more likely to stay.
Maggie, thank you so much. I even wrote down your line, a little more understanding and a little more grace. What a great space that you're creating for the people on your team. Thank you. David, how about we take the second one? How are you embedding the skills into different areas of MUSC? Could you speak to that a little bit?
Yes. So as soon as I took the course a few years ago, Our Community Listens, I literally said to myself, if every person at MUSC took this course, we would be a different organization. So instead of just, sort of marketing this 3-day course of Our Community Listens, we got a little creative in terms of being partners with the Chapman Foundation for Caring Communities. So we're proud to sustain the effort in very creative ways. So I touch all of our new leaders that come into MUSC Health. They're required to take a DISC assessment through the Chapman Foundation for Caring Communities. We tie it into the self-awareness that Maggie talked about. And we also take it a step further and we bring in some compassionate conversations, as we call it internally, on how to deal with conflict and how to give feedback, as Maggie said. That's a continual growth opportunity at this organization that I've heard from leaders, is that they need more tools around the tool belt to give feedback in a helpful, objective way. So we're not avoiding it. Feedback is something that we promote at this organization, but we found that leaders don't always have the tools to do that. So from there, we've also built in 2-hour DISC sessions for anyone at the organization. And boy, they have really taken off. They are like hotcakes. They're like the flavor of the year. I think everybody is wanting to get in on a DISC session to build in that self-awareness and to understand themselves better. And it builds trust, as Maggie said. So if you're able to understand yourself in a different way or have a little more self-awareness, it builds trust not only for yourself, but it builds trust in being able to build relationships. We've also tapped into the university side at this academic health center, where the College of Dental Medicine is using components of Our Community Listens to fulfill accreditation requirements for their academic side. So just recently, we had dental students, about 80 of them, take the DISC assessment. We talked about how this impacts their self-awareness as leading a future healthcare team and leading diverse patient populations. And we've made that crosswalk really nicely between what we're talking about around communication and fulfilling those accreditation requirements to better equip these healthcare professionals to work in the real world. So we're really proud of being able to get into the university side as well. I'll also say that we've encouraged leaders of disengaged teams from our people survey to take the 3-day Our Community Listens course. And I ran some numbers just before coming into the panel. About 90% of our leaders that were leaders of disengaged teams who have taken the course are no longer disengaged in terms of the people survey. So I think that's a testament to their own work and wanting to do better, but it's also a testament to the core skills and the tools that they're gaining from Our Community Listens. And, people around the panel that have taken the course, that we've had people in the class say that this is life-changing for them, both personally and professionally. And I think we're seeing it all in the areas we've talked about: patient outcomes, culture, as well as employee engagement.
David, that's so exciting. And I love how you held on to that stat until live in the moment. That's fun to hear. Thank you. For those of you who might not be familiar with DISC, there are a few times that it has come up in conversation. One element in Our Community Listens class is getting a DISC assessment that really helps people better understand the natural way that they tend to behave and their preferred way to communicate. So we're really starting to raise that self-awareness and focus on how do we better learn how other people might be perceiving us or different ways that they would prefer to be communicated with. And then how do we really develop some skills that can help us style flex or alter our communication style temporarily to really meet the needs of the person that's in front of us. Now, we've been talking about this term culture quite a bit, so I think it can help us to make sure that we're all on the same page of what we're referring to. Culture is the unique way that people in your organization live out, or maybe for some of us are not living out, the mission and purpose of the organization. This is really an opportunity for us to look at the daily behaviors and practices and the engagement level of your team. All of these small day-to-day moments are contributing to whatever culture your organization is building. It can sometimes be helpful to think about what is the unspoken, how we do things around here, right? It's just maybe unspoken or unarticulated, but it's just the natural way that your group tends to show up together. All of these things play a part in forming the culture of your organization. Now, 66% of C-suite executives believe that culture is not just equally important, but more important to business than strategy or operations. Yet, despite that, only 46% of leaders are holding employees or even themselves accountable in order to maintain that culture. So by the time that we get down to the brass tacks of how we feel, only 21% of the people really feel connected to the culture of an organization at all. So it's one thing for us to say that culture is common sense, like we hear the term quite a bit. You may see articles popped up on LinkedIn on how important it is. It's still not always common practice. And I think a lot of that can come from the fact that our organizations have so many other things that we're trying to accomplish and keep track of and move forward. And the healthcare industry is incredibly demanding. And so, Maggie, given the demands that you're facing in the healthcare field, how is it that you are even keeping this culture work on the radar?
Sometimes that's, really tough, but I mean, being a leader in general is really hard. Constantly navigating stress, turnover, engagement, unpredictability, all the other things, of being a leader. There are days that are really heavy, days that I ask myself, am I doing enough? What am I doing wrong? How can I do better? How can we do better? And for a long time, I carried that weight all on my own, just thought maybe this was part of the job and this is just how it was going to be. But after I took the course and have really encouraged this and supported this from my leadership team and my team, a big part of sustaining this for me has been leading by example. I learned early when I took this role that if I was going to ask others to grow or to do anything, that I had to be willing to do it myself. So I've been intentional about role modeling and what it looks like to have hard conversations with grace, to listen without judgment, and to show up with some humility, and also, practicing with the leaders that have taken the courses and want to practice this. And we go through scenarios, and they talk it through with me because I have them take on these conversations to learn, to experience, to get practice. So again, I've made it an expectation of all of my leaders as part of their own development, because I believe in it so much. I believe in all of us speaking the same language, holding each other accountable, holding each other to the same standards. And what's also helped me sustain this is really the people around me, the team that I work with. Our team has grown so much, and we're actually connected. We're more supportive of each other, more caring. I don't feel like I have to carry it all alone anymore. And it's really nice to share the load. Again, my charge nurses and leaders have really developed more self-awareness and confidence. And they're really more intentional in leading with empathy. So I think the collective growth has really made a difference for our unit. And then really focusing on the why. Why did I take this course? To be a better leader, right? To lead with more humility and empathy, and to connect with my team at a different level, and not just manage them and manage the day-to-day operations, and just really forming a relationship with them. And thanks to the Chapman Foundation, I feel more grounded, more connected, really more than I ever have, and more confident in communicating with them about anything, holding people accountable, and really just mentoring and coaching the other leaders in the unit to do the same.
Maggie, I love the continuation after the class of let's keep getting together and keep the skills right in the forefront. Thank you. David, how about MUSC as a whole? I would imagine there are some people on the call thinking, oh, I wish my organization would do this. Talk a little bit about why it is that MUSC is prioritizing maintaining this culture of care, how you're going about that.
Yeah, and for me, I mean, I might be a little biased, but it's a no-brainer in terms of why we would prioritize this. It impacts everything we do on a day-to-day basis as a healthcare organization. And the principles and the vision and the philosophy of the Chapman Foundation really align nicely with who we are as an organization. So our values are very similar. We talk about compassion and respect and being able to develop high-functioning teams. But in order to do that, we got to be able to communicate and treat people well. And, we would be a different world if we were able to really instill this vision of putting people first and allowing those people in our span of care to feel heard and to feel supported and to feel like their leaders actually want to care about them and prioritize their well-being. We would be a different world. And so, I want to pull out a few points that I just heard our system CEO talk about on a recent town hall, because we're strategizing at this organization, leadership communication across the board. And he talked about 3 points that I wrote down. Number 1 is patients want to feel heard. Number 2, patients want to be treated with courtesy and respect. And number 3, patients want to understand what's going on. And if I can't make that alignment between how the Chapman Foundation and our community listens can align with those 3 points that our CEO made, I'm missing the mark, right? And our employees, not only our patients and families, but our employees, our care team members, as we call them, Maggie and that MSICU, we all want these behaviors where we want to feel heard and we want to be treated with courtesy and respect. And the course of Our Community Listens really instills those values and behaviors. And it's not just a course that, we're expecting you to take a 3-day course and take some good notes. We want to talk about sustainability. So through this, how do we change our organizations that are out there? And those of you that are in healthcare that aren't at MUSC, feel free to reach out to us and we can talk to you about how we did it, because it makes sense. And that crosswalk between caring for others and putting those in our span of care before ourselves, it makes sense in what we do every day in healthcare with our patients, families, visitors, and our employees. It's important work. And like I said at the beginning of this call, if we cannot achieve any organizational success or strategy if we do not put people first. And I think some of us in the world have lost track of that. And we need to get back to sort of the why of why we do healthcare. And it's because of the people.
David, it's great to see how you're drawing those connection points and appreciate the offer to help other healthcare organizations that are considering what might this look like. David and Maggie have both offered to be resources to people if you want to dive in more deeply into information. Lainey will be able to share their email addresses as well if you're looking for some specifics about their stories. Just so everyone knows, we have one more question that's scheduled for David and Maggie, and then we're going to open it up for Q&A from the group. So I know Lainey has already gotten a couple of questions submitted, but please feel free to send those in the chat and she'll help us guide through those after we're done. Maggie, this next question is really just an opportunity to hear from you to share a story or a moment that really captures the impact of the culture shift that you're experiencing.
I'd like to read something. Let me pull it up here. I'm just going to pull it up on my phone. I'd like to read this email that I received from my clinical staff leader that I put into this course. I'm extremely proud of her. She has done so much self-reflection and just so much growing in her. She's been a CSL for short for about a year and a couple months. And she really took this course and like a sponge soaked up everything that she could from it. So I'll read you what she wrote me. When I stepped into the clinical staff leader role, I honestly had no idea what to expect or how much I didn't know about leadership and communication. I thought I had a decent understanding and skill set, but I quickly realized there was so much more to learn. Walking into Our Community Listens, I was excited for what the next 3 days would bring, but I was completely unprepared for just how much it would change me. Each session pushed me to reflect in ways I hadn't before and challenged me in numerous ways, including breaking habits I've carried my whole life when it comes to communication. By the end of one day, I was emotionally and mentally drained, but at the same time, I couldn't wait to go back and see what else I would learn. By the end of the final day, I was actually sad that the class had come to an end and I wouldn't be waking up to come to class again. The experience opened my eyes to how I can improve communication, not just at work, but in every area of my life. It gave me tools I didn't realize I needed, and it challenged me to slow down, really listen, and connect on a deeper level with the people around me. What made it even more special was the Chapman Foundation partnering with MUSC. Sitting in that room, I got to share the experience with people I had never met within the organization, people that I consider friends, and people I've admired my entire career. That mix created something really unique and allowed us to all fully submerge ourselves into the class and come away with it with memories that we will not forget. To this day, what I learned in Our Community Listens is still something I use in every aspect of my life. It's truly an experience I can't recommend enough, and I highly encourage anyone to attend if they ever have the opportunity. You won't regret it.
Thank you, Maggie. David, how about you? Do you have a story that you'd be willing to share?
Yeah, I have a shorter story. I actually have a lot of stories. I was trying to think of just one in particular. But there's a nurse manager who is at one of our hospitals within the system. And not only did it change her professionally, but she sat me down one day and she was talking about how she had a difficult relationship with her teenage daughter, and that this course has changed her entire relationship with her daughter. And I'm getting emotional talking about it because she got emotional in the hallway when we were talking. But the profound impact that this had on this nurse manager was profound. And for her to share that with me, and for her to explain the impact that not only has made professionally, but personally through every aspect of her life, I thought really painted the picture of how this has literally changed people's lives and how they experience leadership or personal lives or their relationships just in general.
David, that's great. It reminds me of Maggie. I think you said the ripple effect, right? That also has a ripple effect across multiple different relationships for people when they go through the course. Thank you. All right, now, David and Maggie, we're officially on to the Q&A part. Lainey has sent me a couple of questions that have come in. So this one's going to be popcorn. I won't call on either one of you. Whoever wants to come off mute first is welcome to field the question. And then if you did not get to answer first, but you still have something you'd like to add at the end, we can go ahead and do that before we move on. All right, the first question. What advice would you give to other healthcare leaders who want to start this work? Where do we begin?
I can start. I personally would say go into this course very open-minded, be very vulnerable, and allow yourself to participate 100%. Because I think you get, if I'm being honest, I've taken the course multiple times. Each time that I have gone, I have gotten something different from it. So I think just being open-minded and really being very vulnerable and allowing yourself to recognize the skills that you really didn't have, and just growing on them. And speaking with other people in the class and learning their experiences, I think is also a key piece to bringing a lot away from that class.
Thank you, Maggie. David, would you add anything?
Yeah, I think sort of, from an organizational perspective, get those key players involved in the course so they can see the crosswalk as well between the content and how it aligns with the things that we talked about through this panel. Because I think if they see the content for themselves, I think they'll see that, as I said earlier, it is a no-brainer in terms of how this aligns with healthcare, and how you will be a stronger organization with, making those alignments within what your own values stand for, your mission, vision, and how it can tie into culture and employee engagement. So invite those key players at your organization to experience the content.
Thank you, David. Looks like we have another one that came in. All right, you are starting some new work. How did your teams first respond when you started bringing this work or these classes into the organization? Were there any surprises?
When I brought this to my leaders, we actually had David come and do the 2-hour disc session, and my leaders actually were very excited about it. David, I don't know if you remember that day, but they learned a lot about themselves, and were very shocked with some things that they learned, because they felt very differently about themselves, but then quickly learned, oh, but you're right, this is how I communicate. And um, I think that was really interesting to see. So everybody was very welcoming to the idea.
Yeah, and I'll just say, there are some units or departments with the organization that are voluntold to take the class. And after a few hours of experiencing the material, you can see that the mood entirely, it just changes entirely because they realize that this isn't just a course that they're going to sit in a seat 3 days and just listen to a PowerPoint. So it's nice to see sort of that experience shift when they may have had their own expectations coming into the course, especially if someone's voluntold, as we sometimes do at the organization. But to see sort of that shift and gosh, this is something that's meaningful and things that I can tangibly take away.
Thank you both. Lainey, do you mind reading a question that might have come in through the chat?
Sure. So this question is for Maggie. Did you have multiple leaders from your team take the course together, or did you ensure only one took it at a time?
I had multiple leaders. They all took it at different times. And that was just honestly by default because of their schedules. I would say if they can take it together, I wouldn't see any issue with that because in the course you aren't really assigned to sit with the person that you know. And again, if you're going in for the right reasons and you're really absorbing all of the material and practicing and going through all of the different scenarios, you won't even remember that your coworker is in that room. So mine took it at different times, and I have some more going in September. It's also how many seats are available in the class whenever we sign them up.
Thank you, Maggie. David, I know that was directed at Maggie, but do you have any different insights from the other departments?
Yeah, I would just piggyback and say be creative. And as Maggie said, sometimes scheduling won't allow everyone to take it at once. I mean, I'm thinking sort of realistically, we got to keep our floor staffed and we got to keep our units going because we're 24/7. But we can be creative in working with you on sending a few here and there to different offerings. If you're at MUSC, and I know Rosemary is, we have offerings in September and November. And we are building further course offerings for 2026 that will be available soon. But yeah, we can work with you on being creative in terms of who you send to a class, and we can work with you and save some seats depending on what you want to do.
Thank you, David. Lainey, I'm pausing just to see if there have been any other questions that have come in or if anyone else wants to come off mute to share. All right, I will go ahead and move us forward then. Our organization, the Chapman Foundation for Caring Communities, works with organizations and individuals across the nation. And you can see on the left-hand side that we also work with local government, for good organizations, military, education, along with healthcare. Really anywhere that there is a group of people who are saying, we really want to learn how to care for one another and to continue to do our work in a better way. This is one of the slides that we use with our caring workplace organizations, because we recognize that this work of being human-centered, as David said, putting the people first, that this is a journey, not just a destination, but a continuous process of growth and commitment. So we are continually looking for teams and organizations that we know are bold and believing, because deep down they realize their organization can be a true force for good. And as we continue to do this work and to spread it throughout our organizations and our communities and the United States, this is how we begin to change the world. So for those of you who are on the call thinking, I would like to do more of this or learn more about it, there is a QR code here that takes you to, I want to say it's like a 3-question quick survey, but it gives you an option to put your email address in if you'd like to be contacted to learn a little bit more about the programming or caring workplace in general. And also, if you're just interested in saying, hey, maybe I take that first step that David and Maggie mentioned of getting a class where we could get some of our decision makers in the room together, we would love to have you reach out through that approach as well.